everyone. Welcome to my webinar about sleep. My name is Anagha, and I'm excited to be your presenter for today. I hope I can give you some useful information about sleep and its effects on your brain and the body. Just remember that this webinar is for educational purposes only, and to please consult your physician before making any drastic changes to your lifestyle. Before we begin, let me tell you a little bit about Live Well Teens. Live Well Teens is an organization dedicated to informing teens and tweens about issues affecting their health in the form of blog posts and webinars like the one you are sitting in right now. We publish blog posts frequently. We also have two different webinars to accommodate different learning styles. We have the formal webinar and the casual webinar. The casual webinar is the one you're sitting in right now, and the formal webinar is tomorrow. Just a little side note, if you guys have any questions, post them in the chat box on YouTube, and I'll try to answer them. You can also visit the Contact Us page on our website after the webinar and email me your questions. Okay, just so keep in mind, this material is meant for ages 10 to 18, so if some content is too simple for you, it's because there may be young kids watching. Okay, let's get started. So before we begin, let's talk about what does sleep do. There are three main theories of sleep, and sleep is an important part of our biology. The three theories are the energy conservation theory, the restoration theory, and the brain processing and memory consolidation theory. The energy conservation theory says that we sleep to conserve energy. And the restoration theory says that we sleep so that our brain can restore itself. And the brain processing and memory consolidation theory, which says that we sleep to process memories and strengthen neural connections. But our brain does not shut off when we sleep. Actually, far from it. Our brain has genes that only start when we're asleep. Sleeping can enhance our creativity, and sleeping is necessary for optimal emotional health. Sleep and brain development. So sleep is where the prefrontal cortex develops. So sleep is extremely important, especially for kids and teenagers, because sleep plays such a big role in brain development. More than 1 million neural connections are formed in the brain while we sleep. There are also connections between the right and left hemispheres are made during sleep, and the connections between the right and left hemisphere are strengthened. So that's why sleep plays a big role early on. Lack of sleep in childhood can lead to bigger problems, such as cognitive impairment or other developmental disorders. So it's best to make sure that you're getting enough sleep as a kid, especially. Sleep cycle. There are four main stages of sleep, and we're going to go into a little bit about them. So first of all, this is this diagram depicting the sleep cycle. You might see, what is latency? So first of all, latency is the transitional stage between sleeping and awake. So in the sleep cycle, this occurs approximately 4 to 5 times per night. And as you can see, stage 2 repeats 3 times. The majority of our time is spent in stage 2 of the sleep cycle. And there are 2 types of sleep. There's REM sleep and non-REM sleep. So REM sleep has no stages, and NREM, or non-REM sleep, has 3 stages. So first, we have NREM 1. This is the light stage. It lasts approximately 5 to 10 minutes, and this is the transitional stage between latency and NREM. You can produce alpha waves, which are the calming waves, and this is the kind of sleep where you can still hear voices, but then you're asleep. Next, we have NREM 2. This stage is where sleep spindles and K complexes are produced. There are theta waves, and this stage lasts approximately 20 minutes, and our muscles begin to relax, our brain produces activity, and we really begin to sink off into sleep. So for NREM 1, little joke. Okay. So next we have NREM 3. In this stage, this is more of the deep sleep. We have a decrease in responsiveness, and when someone tries to talk to you, you can't answer because you're very deep sleep. And our delta waves increase, along with it lasts 20 to 40 minutes. That's the NREM stages. There's also REM, or REM stands for rapid eye movement. So this rapid eye movement sleep, or REM sleep, is approximately 20% of the sleep cycle. This is the stage in which our brain is actually very active, and this is the stage in which we usually get a lot of our dreams in. In this last 90 minutes, our heart rate quickens in this stage, but too much REM sleep is definitely very bad. So, the importance of REM sleep is by a concept called REM rebound. REM rebound states that getting less REM sleep one night can lead to more time in REM sleep another night. So, if our body needs REM sleep in order to function. So, REM sleep is very important. Sleep can also have different types of waves that are produced. And I know I mentioned a couple of them, but here are the different types. I know there's a lot. There's delta waves. Delta waves are usually in NREM3, which is a deep sleep state. So these are the deep sleep waves. And theta waves, which are sort of not calming waves, but they're in NREM1. So you're just falling asleep and you're just calming down and winding down. Alpha waves, which are when we're being relatively calm or relaxed, but awake. And beta waves, which is when we're being decisive and awake, when we're making decisions or when we're doing something stimulating. And lastly, there's gamma waves. Gamma waves are usually produced in our brain during learning and processing. So when we're at school, when we're learning something new, these types of waves are being produced. So there's something to know. What happens to your brain when you sleep? Actually, there's different parts of the brain that contribute to making sure that you have a restful sleep. We have the hypothalamus. The hypothalamus is the part of the brain that shuts down the brain's arousal. It sends signals that the brain should calm down, and it sort of controls the transition between wakefulness and sleep. Next, we have the brainstem. The brainstem plays a special role in REM sleep because it can send signals to the brain to relax body posture. It also communicates with the hypothalamus to control the transition between wakefulness and sleep. We have the thalamus. The thalamus can aid in melatonin production, and melatonin is a hormone that is responsible for sleep. So when you have more melatonin in our brain, we tend to feel sleepier. And the pineal gland, this is the main gland that produces melatonin. It's sort of to help us fall asleep. And one of the main cues for producing melatonin is actually darkness. So when it's darker, there's more melatonin produced because your brain signals that it's time to go to sleep. The basal forebrain. The basal forebrain, there's some cells in the basal forebrain that release a thing called adenosine. And adenosine assists in sleep drive. And last, we have the amygdala, which processes emotions during our REM sleep. Benefits of good sleep. There actually is so many benefits of good sleep. I'm just listing the most important ones, but there are so many benefits to getting 8 hours of sleep a day or more, as we'll discuss later. So, emotional health. Benefits. One of the benefits of good sleep is that you can have improved control over your emotions. This is because when we're sleeping, our brain activity increases in areas that regulate our emotions. So we're more likely to control them. And for anyone when you're sleep deprived, you tend to be extremely irritable and short-tempered and get mad at the shortest things and things that you may not have gotten mad about later. Hunger. So actually, sleep can play a role in our hunger and our appetite, because sleep can control hunger hormones, and when we get deep sleep, our hunger hormones are supposed to stop because the waves tell our hunger hormones to stop, and we stop overeating. But when we don't get enough sleep, we're more likely to overeat, and we're more likely to make poor food choices. The insulin. Sleep can actually protect insulin resistance, which is extremely important to making a healthy body. Immunity. So sleep can actually improve the immune system, because when you sleep, our body makes cytokines and that produce antibodies. And these antibodies can help fight off any diseases. The heart health. So lack of sleep is associated with high blood pressure, and it can boost heart health. So which is why, because high blood pressure is associated with heart health. Sleep can also affect your hair. If you have good sleep, it can actually promote hair growth and you can have shinier, silkier hair. So because chronic sleep deprivation and you losing sleep for a long period of time can cause oily hair. Sleep is important for protein synthesis, and since our hair is made out of some proteins, when we sleep, our hair grows. And some people have actually shown that lack of sleep is associated with hair loss. The best way to sleep is some experts recommend that you use satin or silk pillows. Negative impacts of poor sleep. If I haven't convinced you yet, there are a lot of negative impacts of not getting enough sleep. First of all, not getting enough sleep can lower your ability to make good decisions. And this is because our cognitive flexibility or our ability to adapt when things don't go our way is impaired with sleep loss. And also, we tend to be more irritable, and that can also play a big role. We have creativity and sleep. So, lack of REM sleep can affect the hippocampus, and when we don't have any REM sleep, we tend to be less creative and we tend not to come up with creative ideas and we don't do our job as well. And we also have chronic diseases. Actually, first let's talk about more likely to die in a car accident. Because when we're drowsy, driving when we're drowsy is almost the same as driving when we're drunk. Driving when we're drowsy can be terrible because the reaction time is slower. We'll talk about that later. And chronic disease. So chronic disease can be caused because there's no regulation of hormones when we sleep, and also the sleep affects our immune system. So we tend to have a weaker immune system, and we tend to gain weight, which are both major risk factors in sleep and in other chronic diseases. There's two concepts here. There's sleep deprivation and sleep restriction. And sleep deprivation is how long you can go without sleep. This can mess with our circadian rhythms and it can cause all sorts of memory issues because not having enough REM sleep can affect our hippocampus, and our hippocampus is the part of the brain responsible for memories. Next, we have sleep restriction. Sleep restriction can restrict the amount of hours we sleep. So we're still getting sleep, but we're just not getting enough sleep. This is the most common in teens because of the early times that high schools start in, and it can cause long-term harm and it can cause all sorts of developmental disorders if we don't get enough sleep or if our sleep is restricted for a long period of time. Long-term sleep deprivation. So long-term studies have shown that sleep can control our hunger hormones and digestion, and sleep regulates the body's stress hormones, and poor sleep can lead to cravings and unhealthy habits, and less sleep can lead to our hormones being messed up. So long-term sleep deprivation can have adverse consequences. Long-term sleep deprivation can lead to weight gain and obesity, hypertension, heart attack and stroke, diabetes, immune system deficiency, memory loss, and even depression and anxiety. So it's important to get enough sleep because actually insomnia is a symptom of depression. So people who are sleep deprived have 10 times the risk for depression and anxiety. So it's extremely important to get enough sleep so that we can keep our physical health and our mental health. Sleep and drowsy driving. So now here's a little video.
I'm glad you're in the car. I'm actually kind of nervous.
Okay, so if you guys want, you can watch this video on your own time. And I'll give you a couple minutes to do that. It's a very interesting video, but let's move on. Sleep and driving. So there are many reasons why sleep can have such a bad impact on driving. This is because when we're driving, we use hand-eye coordination, reaction time, scanning for hazards, and judgment. These are all crucial parts of driving, and sleep can impair all of these. Sleep can decrease our sensory responses, so it's harder for us to see and do things, and it can affect our hand-eye coordination because we need hand-eye foot coordination to drive, and when we're sleeping, our body tends to feel heavier and we tend to not be able to coordinate, and it can be harder to do normal things like make a turn or stop. Also, it can make you less alert to hazards. When you wake up after sleeping, you tend to feel alert and awake. But when you don't get enough sleep, you tend to feel very drowsy and you're not as alert to hazards. You can also have a slower reaction time because when you're sleeping, it can take longer for you to spot maybe a hazard or a car turning in a way or a light suddenly turning red. And our judgment can be impaired because those who studies have shown that those who have less sleep are far more likely to take more risks when they're driving, and they tend to not have as good of a judgment. They tend to make bad decisions. And this is not really their fault. This is just because that's what sleep does to your brain. Sleep deprivation is actually equivalent to having a blood alcohol content of 0.05. So that's the legal limit in some states. So it's important that when you're drowsy or sleepy, don't drive and don't tell your parents to drive because driving while drowsy can cause all sorts of adverse effects, even death. So drowsiness can increase the effects of alcohol. So when we're already having alcohol, and then when we're tired, let's say we had a long night out until 2 a.m., then we're facing the effects of drowsiness and alcohol. Fun fact, drivers under the age of 25 are involved in 42% of all drowsy driving crashes. So, so here's a little joke. How much sleep do I need? So, there are a variety of factors that affect how much sleep, but here are some general guidelines that experts have done. So, the recommended sleep time for ages 0 to 3 months are 14 to 17 hours, and then it decreases. But the most important, as you guys can see, is ages 6 to 13 years of age. The recommended sleep time is 9 to 11 hours. And the recommended sleep time for ages 14 to 17 years is usually 8 to 10 hours of sleep. So make sure to get this much sleep. And I know a lot of teens aren't getting it. I know it can be hard because of all the things there are to do with homework and school and everything. There are also other factors that can affect sleep requirements, and these are not the set in stone requirements. These are not what you should. These are just some recommended guidelines. They can be more or less, depending on some factors. First of all, other health conditions. So, diabetics can need more sleep because of insulin levels, because they need more sleep in order to maintain their insulin levels. And for diabetics, poor sleep is associated with higher glucose levels. So, that may be a factor. There's caffeine. Caffeine, when you drink caffeine in the night, it requires interruptions in your sleep and it can lead to more sleep needed because the quality of our sleep is reduced and we tend not to have the same deep sleep that we normally do because we tend to have interruptions and we tend to not be able to fall back asleep as fast. Pregnant women usually need more sleep than most people. And body. Every body is different. I know some people can function with 7 hours of sleep regularly, but however, some people need a minimum of 10 hours of sleep to survive. So this can also play a factor. And sleep disorders. Usually sleep disorders can impair how much you sleep, so it can be you can require more or less sleep if you have some sleep disorders, which we'll go into that later. Circadian rhythms. Don't know, it's not the type of musical instrument. Circadian rhythms are a natural internal biological clock. They're a clock that tells us when we're supposed to wake up and when we're supposed to sleep. Usually, this is responsible for during the day we feel awake, and in the night we feel sleepy. This is regulated by an organ known as a suprachiasmatic nucleus. And yes, I know that's a big word. There are certain circadian peaks throughout the day, and those are usually the times where we're the most awake and alert. So those are the times where you want to be taking a test or doing something productive. And our body temperature and awareness can change. These circadian rhythms can affect our hormone release, and irregular rhythms are actually linked to sleep disorders. So it's important to go to bed and wake up according to your circadian rhythms. Now, there's one thing that can affect your circadian rhythms, and that's jet lag. Jet lag is the feeling that comes when you travel across multiple time zones and your body sleeps at irregular sleep timings. This is because for the last few months, our body's going to be used to waking up and sleeping around the same time. So when we suddenly tell our body, oh, sorry, you have to wake up at 2 a.m. and you have to sleep at 12 p.m., then it gets confused because the circadian rhythms are so used to that. And this can lead to us not being able to sleep or wake up. Irregular sleep patterns. So when we have irregular sleep patterns, which is when we sleep at different times every day. Maybe one day we sleep at 6 p.m., and then another day we sleep at 11 p.m., and then another day we sleep at 8 p.m., just varying that much. So this can have a higher risk of heart disease, obesity, and stroke. Is very common because it can cause weaker circadian clocks because we're not following our circadian rhythms, so they can become weaker. And each hour of variability, which means that each hour that we sleep away from our normal sleep time, can increase the risk by 27%. It's recommended that you go to bed around the same time every day. And the main reason why people have irregular sleep patterns is the weekend versus weekday. Can lack of sleep on the weekdays be made up for extra sleep on the weekends? This is a very common question, and I know a lot of people, especially when school starts, are going to be sleep deprived on the weekdays and assume that they can make up for it on the weekends. This is actually not the case at all. Sleeping more on the weekends doesn't help at all. It can actually lead to irregular sleep patterns, which, as we talked about before, can increase the risk of heart disease, obesity, stroke, all of that bad stuff. It can also create other health problems, and it cannot undo the damage. Sleep is not like money. You can't just pay it off once and expect that you're all good. The best way to make sure that you get enough sleep is to just stick to a consistent time which you sleep every day and add an hour of sleep a day to your routine until you get to the optimal amount of sleep. But sleeping 5 hours, 5 days a week, and sleeping 10 hours over the weekends is definitely not going to help. Break one. Okay, so now we're going to have a 5-minute break. I hope you guys are enjoying the webinar so far, and be sure to be thinking of your questions for the Q&A session. I'll see you in about 5 minutes. Okay, so I hope you guys had a nice break, and I hope you're thinking of your questions for the Q&A session. Let's resume. So there are a variety of factors that can affect the quality of our sleep, and quality of our sleep is just as important as quantity of our sleep. It's important to get 8 hours of sleep or more a day, but it's also important to get good quality sleep. There are many factors, and one example is caffeine and other stimulants. So, a stimulant is a substance that can increase neural activity in the brain. So, it basically increases activity in the brain, for example, caffeine. It can make it harder for you to fall asleep because as it increases activity in the brain, then our brain can't sleep when so much activity. We're only able to sleep when our brain is calm and not so many thoughts running through our mind. This can also delay the timing of our body clock because when we are not able to sleep, then this can lead to us staying up later and our circadian rhythms being messed up. It can also cause interrupted sleep because caffeine can stay in the body if we drink caffeine at night or other stimulants. Then it can actually cause interrupted sleep because it can stay in your body for quite a long time. Caffeine and other stimulants can reduce sleep time. They can be detrimental to the health of sleep because they can reduce the amount of deep sleep that we have. This is because they can block adenosine. Remember, we talked about that before. It's the chemical that assists in sleep drive. So if that's blocked, it's harder for us to fall asleep. So that's why don't have coffee, energy drinks, or other stimulants right before you're about to go to sleep. Alcohol and sleep. Now, I went over this a little bit in one of my other webinars, but let's go anyway. So, drinking more alcohol can develop a tolerance to alcohol. And when we are drinking alcohol, then it can block the REM sleep. So, we tend to have less REM sleep. It can disrupt our sleep quality, and it can cause frequent interruptions in our sleep. And additionally, it can cause all sorts of breathing problems, and it can make you more prone to sleep apnea. And like I mentioned before, this is extremely dangerous for driving because when you're driving, then you're dealing with the effects of sleeping and being sleepy, along with the effects of being drunk. And that's not good. So it's not a good idea to stay up late and drink alcohol because alcohol can make it harder for you to fall asleep and reduce your sleep quality. Sleep and electronic devices. This is a major component. Electronic devices and other technology can make it harder for you to fall asleep because they can suppress melatonin. Remember, melatonin is the chemical that's responsible for our brain falling asleep, and it can make it harder for us to fall asleep. Melatonin can sort of trick the brain into thinking that we're awake. Because you know that blue light that comes from screens? The blue light can make it very difficult for us to fall asleep because it makes it look like we need to be awake because it'll trick our brain into thinking that we need to be awake and it's daytime and it can stimulate the brain. Additionally, when we are using electronic devices before sleep, the bright light may take longer to start NREM1. It can increase sleep anxiety and disturbances, and the notifications can keep us from having uninterrupted sleep. Let's say we left our phone in our bedroom and we turn on the ringer and we're consistently hearing notifications, and this can lead to uninterrupted sleep. The best solutions to this are don't use electronics 30 minutes before bed, if not longer. This is because not using electronics allows the brain to sort of wind down. And this can keep circadian rhythms from functioning correctly. And when we don't use electronics, our circadian rhythm functions are correct because there's nothing to mess with them and tell them that we need to be awake. Second is using a blue light filter. Using a blue light filter can protect our eyes and prevent melatonin suppression. Now, it's still important to don't use electronics 30 minutes before bed. A blue light filter is going to help, but that doesn't mean that you can turn on the blue light filter and use an electronic device. Also, you can prevent EMF radiation waves by keeping electronic devices out of the bedroom. When we're getting a notification, there are signals that are coming into the phone called electromagnetic frequency or EMF waves. And even when we put them on airplane mode, these waves are constantly coming onto the phone and they can affect our sleep quality. And also, keeping our electronic devices out of the bedroom can stop the temptation of using our phone at night. Maybe when we can't sleep, it can stop the temptation of going on social media or watching a video, and we'll be able to fall asleep faster. Another thing is some scientists have said that you shouldn't do anything in the bedroom other than sleeping. This is because it can allow our brain to regain the association of our bed with sleep. And when we start to do other activities, the association that when we get into bed, we're supposed to sleep is gone. Now, remember, all of these solutions, they work, but just because you don't use electronics before bed for one day doesn't mean these are all things that you should try to bring into your lifestyle as much as possible. Not only once or twice, but as much as possible, preferably for a long time. Here's a little joke. So basically, don't be like this person because the electronic devices are keeping her from sleeping, which is why she's awake at 3 a.m. Sleep and electromagnetic frequencies. So electromagnetic frequencies, or EMFs, are the waves that are caused by our phone or Wi-Fi. So those exposed to EMF waves during sleeping, they can have lower quality of sleep because these are very dangerous. These waves can actually cause sleep disturbances and headaches. These waves can also change your nerve function, and the cell phones in the room can cause a decreased sleep function. Those people who have cell phones in the room can have less quality of sleep than people who keep their cell phones out of the bedroom. It's also important because the EMF waves can lower nocturnal melatonin, which is the chemical responsible for sleep, like I said before. And a good way to prevent this is not very many people know about is turn off the Wi-Fi when you sleep. I'm not saying put the phone on airplane mode or turn the phone off, but just try turning off the Wi-Fi, maybe pulling the plug or pausing it. This can be important because it can make sure that all those waves don't interrupt our sleep and we can have a better sleep. Additional factors. There are also a couple factors that can affect our sleep. First of all, we have our bed. We spend approximately 1/3 of our life in our bed, and a good bed should be comfortable. It should make you feel well rested, and it should be not too hard and not too soft. It should allow for good circulation and uninterrupted sleep because when we lie down, our body puts pressure on certain areas of the brain and body. And our bed can relieve that pressure points and allow us for better sleep quality. So it's important to remember your mattress should be a little hard and a little soft. If it's too soft, we end up sinking. And if it's too hard, it can put pressure on our head, our neck, and our sacrum. How our pillow affects our sleep. Our pillow can promote good sleeping posture and it can support the natural curve of your neck. The too high pillow can put a stress on our spine, which is why we can end up with neck pain or any other types of pain in our back area. And the right pillow can depend on our sleeping position. It's important to replace pillows approximately every year or when they become lumpy or shapeless. And some experts recommend that we wash pillows regularly, approximately once a month, to clean out any dead skin. So, when I was talking about posture, some experts also recommend that when you sleep, you should sleep either on your back or to the side. And it's not good to sleep on your stomach because this can promote poor posture in your back. Sleep disorders. Now that I've talked a little bit about some sleep problems and how to get good sleep, let's talk about some sleep problems and disorders. First of all, we have narcolepsy. Narcolepsy is a chronic neurological disorder. This is caused when people feel rested throughout the day, so they get a good night of sleep, but then during the day, maybe in class, they doze off suddenly. And this can cause our brain to enter REM sleep 15 minutes after sleeping. Now, falling asleep in class is one thing. A lot of people do it. This does not mean you have narcolepsy. It's only narcolepsy if have excessive daytime sleepiness or hallucinations. It can be caused by genes, brain injuries, and immune system disorders. There are no cure, and the main thing is that we suddenly start to feel random spells of sleep. Next, we have sleep apnea. Sleep apnea is a sleep disorder when our breathing is interrupted during sleep, and 18 million adult Americans, have it. It's linked to hypertension, and some symptoms include gasping for air in the middle of the night, snoring, and night sweats. But like I said before, just because you snore does not mean you have sleep apnea. Check with a doctor before diagnosing yourself because this is for informational purposes only. And this is also caused by mouth breathing. Mouth breathing is a major risk factor for sleep apnea, and it can lead to high blood pressure. Sleep apnea can lead to high blood pressure, and some other risk factors of sleep apnea include our weight, smoking, and endocrine disorders. More sleep disorders. We have insomnia. Insomnia is difficulty falling asleep or staying asleep in the night. There are two types of insomnia. There's acute insomnia and chronic insomnia. Acute insomnia happens due to life circumstances. Let's say, for example, we have a big test or we have someone coming as a visitor coming in the morning. And this is natural. This is no cause for worry. This happens to everyone. And then we have chronic insomnia, which is when we can't sleep. It occurs 3 times a week. Insomnia can lead to unhealthy sleep patterns, and it can be caused by a lack of melatonin because the melatonin makes us sleepy. If there's no melatonin, we can't fall asleep. Some risk factors of insomnia and risk factors, for those of you who don't know, are things that can increase the risk of having a disease. So when you do these things, that doesn't mean you have them, but that means it can increase the risk of you having them. Some risk factors include traveling a lot, stress, anxiety, and weight. Next, we have parasomnias. What's a parasomnia? So, parasomnias are a group of sleep disorders that involve unwanted events occurring during sleep. It can make it difficult for us to get good sleep. It's extremely dangerous because we can be unaware of our surroundings. Some examples of there are many different types of sleep disorders. And when we have parasomnias, we don't have trouble falling asleep or staying asleep. We just have different activities that come as a result when we're sleeping. Some examples of parasomnias include sleep talking, which is when we're talking during sleep. Either we're having a conversation with ourselves or some other person. Sleepwalking, which is when we're walking while we're asleep, so we end up like walking out of the room and doing things that we're unaware of. And we have sleep night terrors. Night terrors are caused by waking up terrified. It lasts from 30 seconds to 5 minutes, and it can be characterized by screaming or crying for no reason at all. And we don't know what scared us. We just wake up very, very scared. Next is nightmare disorder. So this is when we have troubling, very, very intense dreams. They're too often a sign of nightmare disorder. But just because you have a nightmare doesn't mean you have a sleep disorder. Like people get nightmares all the time. There are certain signs you should look for to know whether you have nightmare disorder, which we'll go into that later. Bedwetting. Bedwetting, which is urinating during sleep. It's very common in kids under the age of 7, and it can be a sign of UTI or urinary tract infection. Teeth grinding. So chewing your teeth grinding is when we're chewing our teeth constantly in the middle of the night. It can cause tooth pain or earaches, and the most common cause for teeth grinding is when we have an abnormal bite. So when our front teeth is from more forward than our bottom tooth, or vice versa. Confusion arousal. So confusion arousal is when we wake up in the middle of the night in a confused state. And we have a slow reaction time. We we're always crying and we're very worried. And we don't have a clue as to what's confusing us. We're very confused. We have a poor memory. And those are some examples of parasomnias. More disorders. There are a lot of different problems that can come from sleep, right? There's restless leg syndrome. Restless leg syndrome is a neurological disorder, and the main symptom is that it can cause an unpleasant sensation in our legs, and we can't keep our legs still. There's an urge to move them. It can cause a tingling sensation, and it can feel uncomfortable. The cause may be genetic predisposition, which means that we inherited it from our parents or relatives. And there's a higher risk for heart disease and stroke because of this. Basically, what happens is we feel a tingling sensation, and then feel an urge to move them. And the tingling sensation goes away when we move them. And usually, for this disorder, our symptoms get worse throughout the night. And then we have nightmare disorder. I told you I'd talk about it later. Nightmare disorder is having frequent nightmares. And just having some nightmares is not a disorder. This is a rare disorder, and these are usually become a problem when our nightmares are causing distress during the day. Because usually, when you have a nightmare, you wake up, oh my God, everything's fine. But when we're having nightmare disorder, then we tend to keep thinking about it during the day. Nightmare disorder has vivid, real dreams that trigger negative emotions. Like I said before, it's only a disorder if they are too frequent or if it causes problems functioning. It can be caused by a lot of stress, anxiety, or trauma during the day. It is a parasomnia. And it can also be caused by, in children especially, when you read a scary book or watch a scary movie. Exploding head syndrome. No, this is not when your head explodes. I know it sounds like it. So exploding head syndrome is a parasomnia. It's a condition that happens during sleep. Some symptoms include hearing a loud noise when falling asleep or waking up. We sometimes also see flashes of light, and it's a type of hallucination, which is when we're seeing or hearing something that we don't know whether it's actually happening or not, and it's usually not happening. No, we're not sure what causes it or where it comes from. It's generally not harmful, and exploding head syndrome is only a problem if you become sleep deprived. So now that I talked a lot about sleep disorders and problems, let's talk about some ways to improve sleep. Some good ways to some sleep hygiene habits. No, this is not staying clean while you're sleeping. Sleep hygiene habits include making sure that we follow some certain guidelines to make sure that we have the best quality sleep. First of all, some sleep hygiene habits include avoid stimulants like coffee or alcohol 4 to 6 hours before bedtime. And because coffee and stimulants can reduce the quality of sleep. Come up with a bedtime routine to sort of ease the transition between staying awake and falling asleep. Avoid stressful work during this time and do calming activities to promote drowsiness. Sleep when you're only truly tired. The rule is if you can't sleep within 20 minutes, then do a relaxing activity to avoid frustration, such as reading. If you can't sleep one night, then one trick that I personally like to do is to start reading a book that you don't like or have trouble understanding. This trick usually works for me. Or if you're having trouble falling asleep, start thinking about what you did that day, and this also works for me. And avoid oversleeping on weekends because, like I said before, circadian rhythms. And exercise for at least 60 minutes a day. Try not to exercise right before you sleep because exercise can arouse you, but making sure to get enough exercise can reduce stress, improve sleep qualities, and increase the duration. More sleep hygiene habits. I know there's a lot, right? So make your bedroom a quiet, comforting environment. And making it dark, making it the right temperature can definitely help. Don't eat heavy meals before you sleep. Try eating meals around 3 hours before you go to sleep, just so that you'll have enough time to digest everything and you won't end up, because eating heavy meals right before you sleep is going to cause lots of sleep problems. And as I mentioned before, follow these tips regularly. Because just because you made your bedroom a quiet, comforting environment and ate meals one time, and you say, hey, why aren't these working? They take time, patience. Also, reduce the fluid intake before bed for obvious reasons. And limit exposure to bright light before sleeping. Because, like I said before, the bright light can mess with your melatonin, which is bad. Solutions. There are also some solutions that we can use. And these solutions are we have to use them with sleep hygiene habits, and I will talk about that later. So, lavender scent can promote relaxation, and lavender can increase slow wave sleep and improve our sleep quality. Lavender can allow you to feel more refreshed, and it can help fight insomnia. However, it may cause the side effects. Make sure to consult a doctor. And some good ways are using lavender essential oils and lavender scented lotions. Yoga. Yoga can also help fight insomnia because people who pursue yoga every day have less sleep problems, according to lots of studies. Yoga can help you sleep faster, stay asleep for longer, and wake up less. Some yoga can be energizing, and it's important to do calming yoga. If you do some energizing yoga and then try to fall asleep, it's not going to work. Your efforts are futile. So, the yoga can make you to fall asleep faster in the middle of the night if you do wake up, and you feel more refreshed during the day. So, for yoga, that's yoga. And then we have meditation. Meditation is also an important thing because meditation can increase our sleep time, improve sleep quality, and make it easier for us to fall asleep. The good thing about meditation is that it's all natural, medicine-free way. Meditation can reduce some measures of arousal in the brain. It can sort of calm down all of our cluttering thoughts. It can be done anywhere and anytime. And it can help by reducing heart rate and blood pressure, and by increasing melatonin. Red light therapy. So, for actually avoiding blue light is first. So, avoiding blue light is important because I've mentioned this several times throughout the webinar. Is blue light can shift our circadian rhythms, and that lower wavelength of the blue light can harm our eyes, and it can cause kids to have less REM sleep. So, some good ways to solve this is using a blue light filter. A lot of phones have blue light filters, so if you just go to settings and try to turn them on, they will work. Install a digital curfew, which is maybe around 9 o'clock is when all phones and electronic devices are stopping being used and we do other things. And avoid devices 2 to 3 hours before bed. Red light therapy. Red light therapy can actually help you fall asleep. It's not actual therapy, it's just when we use red light because red light can stimulate melatonin. This is because red light has a lower color temperature. It can allow our body to ease naturally into sleep. It doesn't alter our internal clock, and it can improve sleep quality. It can also produce more melatonin when we're exposed to red light, so our brain produces more melatonin. With some good ways to implement this are using red light bulbs and change the light on our screen to shift from blues to reds and yellows, using the blue light filter. Temperature. Temperature plays a big role in sleep because melatonin helps the body lose heat, and a cool temperature can speed up the onset of sleep. Our body craves a certain temperature to sleep. The recommended temperature is 60 to 68 degrees Fahrenheit. It's an important factor in our sleep, and some things that I've seen some people do are to keep a heavy blanket and a light blanket, so when we feel hot or tired, we can have the optimal blanket for our needs. Next, consume magnesium. Magnesium is an important nutrient, and it's important that everyone gets enough of it. It can help you sleep better. It can activate the parasympathetic nervous system, and it regulates melatonin. It quiets the nervous system, and it prepares our body for sleeping. It can help you achieve deep, restful sleep because it can block some of the more exciting neurons. And some magnesium-rich foods that you could eat include avocados, spinach, and okra. So those are good foods to eat. They're healthy. Stop mouth breathing. Now, mouth breathing doesn't filter air like your nose does. Mouth breathers are more likely to experience sleep disorders because nitric oxide is produced when we breathe through our nose, and our brain needs nitric oxide to sleep. And something I've seen some people do on the internet is mouth taping. So put some tape over your mouth when you sleep. And this is probably not a good idea because it can be dangerous. So it's best to consciously try to breathe through your nose rather than your mouth. And that's a better way better than mouth taping. Then we have gut health. So research shows that our gut produces many sleep hormones and neurotransmitters, such as serotonin, GABA, and other hormones. These hormones can communicate with our nervous system and affect the production of melatonin. So when melatonin is produced, when our gut is healthy. So some foods that can help our gut generally are vegetables, beans, and fruit. So eat lots of fruit and lots of vegetables and lots of beans because those are good for you. Sunlight. So they actually say that only 20 minutes of sunshine can trigger the brain to release chemicals. These chemicals can regulate circadian rhythms and allow you to sleep and wake up regularly. Because our brain associates light with waking up and dark with time to sleep. Sunlight can boost serotonin, and the serotonin can turn into melatonin in the night, and it can produce restful sleep. And lastly, we have valerian root. This is a herb that can treat anxiety, stress, and muscle spasms. It can help with insomnia and sleep issues. It can lower our blood pressure, and it can reduce the amount of time it can take to get sleep. It can also cause you to be sedative and calmer by increasing the brain's GABA. It can reduce the time it takes to sleep, and it may cause excitability and uneasiness as a side effect. And also talk to a doctor. Please don't take this on your own. And remember, just because you take valerian, you still have to follow sleep hygiene habits. If you're going to watch computer or phone until 2 a.m., take 3 coffees or energy drinks until 12 a.m. in the morning, and eat pizza at 11 p.m. in the night, then that's not a good idea. And you can't say, "Oh, I took valerian root, everything should be fine." That's not a good idea. There's some sleep hygiene habits you should also follow. So those are some sleep hygiene. I hope you can implement some of these in your own life. Thank you for coming to this webinar. I hope you guys had a nice time and learned a lot today. So now I'm going to open the floor for the Q&A sessions. I'm going to give you 2 minutes. So if you guys want any Q&A to ask any questions, feel free. I'd be happy to answer them. Okay, first question. Thank you for asking this question. The first question is, does the REM sleep affect the hippocampus in any way? So during REM sleep, there's intense activity in our limbic system, which is some structures that are involved in emotion. 2 of these structures are especially active, the hippocampus and the amygdala. When we don't get enough sleep, it can impact the hippocampus because sleep deprivation is detrimental to hippocampus-dependent memory. And as the neural correlate of learning and memory, sleep deprivation can disturb the synaptic plasticity in the hippocampus. So the simple way to put this is REM sleep can impair the process of how our brain processes fears and short-term memories into appropriate long-term memories for long-term storage, which is why sleep is extremely important, especially REM sleep. If you guys want, whoever asked this question, you can see the movie Inside Out. It's an excellent movie, and it talks a lot about the brain and from a scientific perspective. So thank you for asking that question. Okay, it looks like that's the only question. Thank you for listening to this webinar. You guys are all amazing. And I will see you next week. Sleep well tonight. Bye.